Chronicles. Characters are Frank, the radio host interviewer, and Dexter, blood stain pattern analyst. Podcast script is Forensic Wound Analysis. Introduction. Welcome back to Crime Scene Chronicles, the podcast that explores the fascinating world of forensics. Today we are talking about understanding wounds with expert blood-stain pattern analyst Dexter. Dexter, thanks for joining us. Thanks for having me back. Let's begin with the definitions of laceration and incision. Frank, there is a difference between these two types of wounds. The laceration is a tear in the tissue due to blunt force. Think of a fist punching the face and the eyebrow gets ripped open. That rip is a laceration. The tissue has bridging within the wound, which is a hallmark of a laceration. An incision is a wound that is caused by something sharp. This is easy to remember because surgeons cut an incision with the scalpel. An incision is made by anything that is sharp-edged, even like a shard of glass, and causes a wound with clean edges. So the main difference is that the laceration has this tissue bridging and can look jagged, whereas the incision is a sharp cut. Yes, Frank, that's right. An incision is best remembered like a clean, straight cut by a sharp object like a knife, whereas a laceration is a wound that is jagged and caused by blunt force. Let's talk about gunshot wounds and distance. Great information, Dexter. Now let's talk about these gunshot wounds. I know that there are 3 descriptions about gunshot wounds called close contact, close range, and long range. How do you figure out distance on gunshot wounds? Well, let's talk about the contact wound first, Frank. Contact wounds are the simplest to determine. All it means is that the muzzle is placed directly onto the skin. The way to know that this is the powder, residue, and soot are blown into the wound track. There is also a muzzle contusion and possibly an actual imprint of the muzzle onto the skin. Dexter, can you tell me about a close contact wound? Sure, Frank. Close contact is specifically when the distance is between a few inches and about 4 feet. The main difference is that instead of evidence within the sound, we see that the evidence is outside the wound. In this case, we will see soot on the outside that wipes off easily. Also, there's stippling. It's caused by unburnt or partially burnt gunpowder particles smashing into the skin and cannot be wiped away. This is the main way to identify intermediate range. We can estimate distance by the density and spread out of the stippling. So, can you tell me something about the long-range wound, Dexter? Yes, the long-range wound doesn't have anything to show on the skin, so this is when the gunshot is greater than 4 feet. The bullet hole is a key feature in this case. So, Dexter, can you tell us more detail about the differences in the sharp object wounds and the blunt force injuries? Yes, Frank, we have to talk about the tissue damage because that is the key to understanding the difference. We will begin with blunt force trauma, which is caused by a non-sharp object. Think of the bat hitting tissue. A bat's not sharp, but causes a huge amount of damage to tissue. It hits with the force that smashes and crushes the tissue, sometimes tearing it apart. There are 3 types of blunt force trauma injuries. These are contusions, lacerations, and abrasions. The contusions are also known as bruises, and these are caused by blood collecting under the skin. The area can get swollen due to this collection of blood, and the skin itself will turn different shades of colors. The lacerations, as we have already mentioned, are caused by the impact that is so powerful that the tissue basically will burst. It creates a wound that's irregular, with tissue bridging in the base of the wound. The wound is often a jagged shape. The abrasions are when the very top layer of skin is removed from the blunt force trauma. An example of this is road rash. The road is the unyielding blunt surface that meets the tissue and causes the abrasion. So, Dexter, can you go on and tell us about sharp object wounds now? Yes, these are the wounds that are caused by stabbing and cutting instruments. They cause a separation of tissue and cause damage only at the actual resulting cut or stab. Stab wounds are deeper rather than long. An example is a knife. Meanwhile, incisions are long, clean cuts. An example is that made by a surgeon's scalpel. I feel this is the real exciting part, Dexter. Let's match the wound to a specific weapon. Is it true that you can match the wound to a weapon? If so, how is it possible? Well, Frank, it's not always a clear match, but we do our best by following a process. We first try to determine the class of weapon. For instance, is it a screwdriver or a knife? Then we measure the width and length of the wound and see if we can match it to the blade. Next, we take a look at the tool marks and imprint patterns. At this point, we can look for patterns that match up. Gunshot wounds are quite a bit more detailed. We look at the recovered weapons and we check the fired bullet from the weapon. Then we compare the bullet under the microscope and look for striations on the bullet in the casing. This is where that also includes a fire pin impression and breech face marks that are unique marks. We use all of that to match it up to the firearm. Wow, Dexter, that is so much more to consider than I ever thought. This has been very interesting. Thank you. Well, I enjoyed it. Let's do it again. Folks, join us next week on Crime Scene Chronicles.